Hey everyone, so today we'll be starting with anesthesia. So before starting anesthesia, I want you to know how we'll be covering anesthesia. So we'll be covering anesthesia in 16 parts, and after doing these 16 parts, you will be able to answer almost 90% of the MCQs, provided if you also solve PYQs and add these to your notes. So please make screenshots or notes from these videos and add PYQs, and then you will be able to answer 90% of the MCQs. If you're not able to answer 90% MCQs, it means you should practice more MCQs. For content wise, these videos are definitely sufficient. So without delaying it for further more, let's begin with the anesthesia. So coming to anesthesia, part 1. So we'll be starting with instruments first. Coming to the first instrument, that is Judel's oropharyngeal airway. So it looks something like this. It has to be aligned in 180 degrees in patient's body, and it is usually used in unconscious patients. So it prevents tongue fall basically. Tongue fall is prevented. Now this it is inserted by measuring the angle of mandible and angle of mouth. So you will measure these angles and you'll be inserting this Judel's oropharyngeal airway. And next we'll be talking about nasopharyngeal airway. So nasopharyngeal airway looks something like this, and it is inserted in conscious patients. For this, we'll be measuring angle between ear lobule and the nose. So we'll be measuring angle between this. And contraindications for this airway device will be skull injuries and coagulopathies. So these two are contraindications for nasopharyngeal airway. Now we'll be talking about laryngeal mask airway. Laryngeal mask airway or supraglottic airway devices. So here we have first gen LMA and second gen LMA. We have third gen LMA. We have supreme LMA. We have slipper. Then we have Buska, which is mostly Buska mask. And we also have fast track LMA. And then we have iGel LMA. So these are types of LMAs. And coming to the first gen, this is also called as classic LMA, and it looks something like this with a single port basically. That's the most important point you have to remember about first gen. And coming to second gen, we'll be having two ports. One port is for aspiration and another port is for oxygenation. So we will be having two ports. So here we will be having one more port in second gen, and third gen, which is also called as iGel LMA. So I wrote it separately so that you will be remembering that these both have different names, which you can confuse like as two LMAs, but they're actually one. So third gen LMA, it has accommodation capacity. It actually accommodates to the shape of larynx, and then it is devoid of inflation port. Inflation port is absent, and it is self-adapting basically. It is self-adapting. And coming to next part, that is Supreme. So Supreme is basically made up of PVC. It is simply disposable or one-time use LMA device. So we'll be using it only one time. And Slipper is streamlined liner of pharynx airway. So it is streamlined liner of pharynx airway. It is something like this. It's like a bag, plastic bag like thing. And we have Buska mask, sorry. Buska mask basically is a new device and it helps in positive pressure ventilation and also suction clearance. So these are the two specialities Buska mask has. Coming to fast track, as the name says, we can do things fastly with fast track LMA. So we do intubation along with laryngeal airway clearance. So intubation can also be done. It means the required tools for intubation are also present in this LMA device. So these are about LMAs, and we have two more points to remember in this session. That is ambio aura LMA. So this is one type of LMA device. It is a first gen LMA. This is just a point you have to remember or memorize. So ambio aura LMA is a first gen LMA. Coming to next one, that is sizes of LMA. So you just have to remember in this order: male, female, and child. So for male it is 5, for female it is 4, and for child it is 3. So this is about the first part of anesthesia. I hope it is very clear and calm. Next we will continue with part 2. See you later. Thank you.